My name is Dhikhil Sedi. I'm a Quality Needs Coordinator in the Department of Hospital Administration in Sanjay Gandhi Postgraduate Institute of Medical Science. So here I'm going to, give a glimpse of the monkeypox in different views, in multidimensional view, because monkeypox is a zoonotic disease which comes from animals. So obviously the veterinary people are involved. As the climate change is grossly affecting the natural habitat of the animals, so the environmentalist, pollution control people, all those people are involved. And of course, when it comes to a disease, we all are involved, and the public administrators are also involved. So it's totally a multi-dimensional view, and inside our paradigm, again, we have medical view, nursing view, physiotherapist view, different view. So I will try to give a glimpse of few of such view on the monkeypox, which we may treat, we may encounter in the upcoming days. So these slides and these informations are basically from the source of WHO. So you can see the picture of rashes all around the face and extremities, and more in chest also. But quite interestingly, you can see in palms and sole of also it is quite common. So this is a characteristic feature of monkeypox, which differentiate from other similar kind of illness. So basically, it is an infectious disease caused by a monkeypox virus characterized by severe rash. That is a basic definition we say. Typically, it is a self-limiting infection, but can lead to severe illness or death. And more than that, it can cause many complications. If it gets into eye, that can go to blindness and all. Death occurs in up to 11% of cases. That is really high. Most often in younger age group. That is really concerning. And there are variants also which we'll be discussing. And one of the variant goes for death rate of nearly 11%. So that is the basic about the monkeypox. Now coming to the zoonotic transmission. Exact natural reservoir of this virus in animal kingdom we are exactly do not know, but we know certain host and they are quite common everywhere. Monkeypox occurs primarily around the rainforest of the West and Central Africa. These both places have different strains also. The natural host of monkeypox, as I said, it is unknown. Many species of small rodents and non-human primates are susceptible to monkeypox virus. Following the eradication of smallpox, as we know, 1980s it is being eradicated. We do not have any vaccination program still going on for that. So because of that, what happened means the natural protection against this series of viruses totally changed from our human beings immunity. So because of that, we are more prone to get this kind of infection. So as I told you, like you can see, field biology, veterinary medicine, and public health, disease ecology, all these are interrelated in this scenario. Now a bit about orthopox virus. They are, there is one very dangerous virus which we have encountered before, that is smallpox. Like cowpox virus and variola virus, which causes smallpox, the monkeypox virus is a species of the genome orthopoxvirus in the family Poxviridae. Monkeypox is a zoonosis transmitted to humans from animals with symptoms similar to smallpox, although very less severe than comparing to smallpox, where the people die around 1/3. Smallpox was eradicated in 1918 and vaccination ceased. Waning immunity may be a factor of emergence of the monkeypox. You can see the picture of the virus, which we can see with the use of electron microscope. It is subtyped into two clades, two groups. One is Central African clade, prevalent in the Central African Republic, Democratic Republic of Congo. We mostly associated this virus with the Congo and other countries. Clinically, viruses in this clade causes more than severe illness and case fatality up to 11%. This is more dangerous than the West African clade, the other clade, which we primarily say it is Nigerian based. And there are other countries like Liberia, Sierra Leone, etc. But mainly we call it as a Nigerian one, from where it gets transmitted to other parts of the world. This monkeypox virus has caused less severe damage to the people and less complication has been observed in this virus. Quite unfortunately, the monkeys will be, cursing us as this is not primarily in monkeys. Like human beings, they also get affected with this virus. Monkeypox virus first identified as an illness of a non-human primate. The virus is also found in rodents. Monkeypox virus is human first identified in 1970 in Democratic Republic of Congo. Democratic Republic of Congo routinely reports high number of cases, more than 1,000 suspected cases per year since 2005. Now, the Europe has more number of these cases, especially UK, Germany are nearly having nearly 1,000 to 1,500. In that scenario, that number of cases are being reported in current state. And as being, a routine people exchanged through flight and other modes, it is very common that it will soon come to India like COVID. So we must be prepared once again. Now coming to the geographic distribution, this distribution, what we see here is 2016 data. You can see here we have the African region. This we have this Congo region, and where Congo clade is more, and this is the second clade, the Nigerian clade is more in this part. And now we have it has moved out to United States of America and UK and Israel and Singapore. These were the 4 or 5 countries which was reported. And this Benin and Sudan, which was imported the virus from the near countries, although they do not have this virus. But now that is not the case. The case that it has gripped into more than 54 countries, especially the Europe. It is very widely prevalent there, and it is spreading like anything. And moreover, the people, the identification says that it is a moreover of a Nigerian type of clade. So the case mortality is comparatively less. You can see the rodent here, animal to human transmission. Human infection has occurred from handling infected animals, giant poached rats, raw squirrels and monkeys. These animals had this virus, and most probably this would have come from these animals to human. Infection results from direct contact with the blood, body fluids, external lesion of the infected animals. These three are the common cause from animal to human transmission. Eating inadequately cooked meat of infected animals is a possible risk factor, which we have not yet concluded with the evidence. Most human infection, the source is not known. So we are still lagging a lot in understanding how this is got into human beings. The same applies to COVID also. Still so many theories are going on, but still we are not clear about anything so clearly. You can see a lot of good animals, beautiful animals, and these animals harbors this monkeypox virus with them. This complains, Gambian pouched rat, dwarf dormus marines, sun squirrel, and rob squirrel, Columbus monkeys, sooty, megabe, all these things harbors, host monkeypox virus. Now, coming to the human-to-human transmission of this monkeypox virus. Human-to-human transmission results from close contact with infected respiratory droplets. Respiratory droplets, I repeat, respiratory droplets, skin lesion, and contaminated objects. Healthcare workers and household members of active cases are at the higher risk of infection. One of the case fatality, not now, in before case, historically when it was recorded, one of the mortality happened to a healthcare worker who was taking care of a patient with this disease, and from there we identified that this is going to be a very risk factor for the healthcare workers, just similar to COVID-19 infection. As human-to-human transmission is very limited, most outbreaks consist of only a few cases within the families. That is also a good part of it. But quite differentiatingly, we can say the second clade, the Nigerian clade of this virus, transmit very less than the Congo clade of the virus. This is also an information about this virus. Now, the incubation period. Incubation period, as you all know, incubation period is the entry of this virus into the human body till the body start to show some kind of reaction or some kind of symptoms. So the interval from infection to onset of symptoms is usually 16 to 13 days. Usually, that time is very important, but can range from 5 to 21 days. So we conclude it is 5 to 21 days generally. So you can see a beautiful kid with rashes all around the body. So the disease course. The disease follow a particular series of course. Unlike other diseases, we will discuss about the comparison of this disease with other disease also, how the pattern of this rash develop and how you can differentiate between the monkeypox and other viruses even before, in a way, I would say, seeing the rashes and the pattern of the rashes. The infection progresses into two phases. One is the invasion period, that is 0 to 5 days, characterized by fever, headache, lymphadenopathy. This is a very characteristic feature which was not available in the smallpox. Swelling of the lymph nodes, back pain, myalgia, muscle aches, especially on the back side, fatigue. And a characteristic rash appearing in stages 1 to 3 days after the onset of fever, beginning on the face and spreading to trunk and limbs. You can see the most of the rashes are seen in the extremities, and this has a characteristic part of this rash also. It will be visibly available in the hands and sole of the foot. So this is a rare exception which is very less found in other cases of this virus family. The monkeypox, an evolving rash. The rash lesions evolves from macules, which is very flat base, and to papules, which is slightly raised lesions, to vesicule, which contains the clear fluid, and then to pustules, and then it follows to crest. So this pattern is very consistent in this disease, and almost all these rashes follow the similar kind of movement in these 5 variation in these lesions. So I will repeat once again: macules followed by papule, and papule will move to vesicles, and from vesicles to pustules, and pustules to crust. So from flat base, a raised base with a clear fluid, then it goes to yellowish fluid, and naturally it goes to crusting. And once when it is crust and underlying skin is newly formed, the patient usually get out of the disease. So the rash affect face in 95% of the cases, palm and sole of the feet in 75% of the cases, oral mucous membrane in 70% of the cases. This is horrible. The kids, the babies, and even the big people also who get this, mucous membrane lesions, a rash, they do not take food, and because of that, the nutritional as well as dehydration, other kind of problems comes, and this will, largely contribute to the morbidity and mortality in a very high manner. And it has reported to have genitalia also involved, and conjunctiva and cornea. It is only affecting in 20% of the cases, but this usually lead to a complication of blindness, and this is really important in this case. It may take 3 to 4 3 weeks for the crust to disappear, and once when the crust is totally healed and it started to shed off, and the underlying skin is formed clearly, usually the person remains as not transmitting the disease. Extent and duration of the illness. You can see a big rash there. Lesions range from very few to several thousands and are often very painful. Severe lymphadenopathy, swollen lymph nodes, is a distinctive feature, very distinctive feature of monkeypox, which generally develops before the rash. Monkeypox usually lasts 3 to 4 weeks, and severe illness occurs more commonly in children. That is more terrifying. And how you can make the differential diagnosis with the other measles and smallpox, which is now, smallpox which is now eradicated. Monkeypox can resemble with this disease. Other condition that should be ruled out is bacterial skin infections, scabies, syphilis, and some type of medication allergies also. Early consideration include other febrile illnesses also, because these rashes will develop only 4 to 5 days later. Laboratory confirmation is necessary to make a proper definitive diagnosis in this case. Now you can see we have differentiation between monkeypox, chickenpox, and measles. We have left out with the smallpox because it is less relevant in the current period. Fever, it occurs in all the 3 cases. Although in monkeypox, it is the fever remains near more than 38 degrees centigrade, and rash after 1 to 3 days. Whereas in chickenpox, it is for 0 to 2 days, and in measles, it is very high temperature, rash after 2 to 4 days. So it is very difficult to differentiate here. Rash appearance, see this pattern. Macules, papules, vesicles, pustules at the same stage at an area. This is very distinctive. But in chickenpox, we get it in different stages, several stages. And in measles, non-vesicular rash in different stages you get. Rash development is very slow. It takes 3 to 4 weeks. In chickenpox, it is very rapid, appear in crops over several days, and measles also it is very rapid. It comes within 5 to 7 days. Rash distribution starts on head, more dense on the face and on the limbs, and appears on the palms and soles. This is very characteristic. And in chickenpox, it starts on the head, more dense on the body, absent on the palms and soles. It is more common in the body than on the, limbs. And in measles, it starts on the head and in spreads, it may reach to hands and feet also. Now, classic feature with the monkeypox is lymphadenopathy, and in chickenpox, it will be really itchy. One more thing about chickenpox is the rashes are very painful than the other two. And in measles, we have complex spots. Death up to monkeypox, it is nearly 11%, and chickenpox are rare, and measles, it varies. So these monkeypox, especially about the Congo clade, it is very more common, up to 11%, which is very, very concerning. Now, coming to the laboratory diagnosis. Various stages of the disease, we used to do different diagnostic studies, but only differential diagnosis can be only done by PCR test. We have other different tests also. Monkeypox can be confirmatory by laboratory. Best specimens are from the lesions, fluid, roof, and the crust. You can see in that picture how one person is taking the sample from a lesion. Virus can be best identified with PCR and also antigen and antibody detection methods, but they are not specific. Specimens from persons and animals should be handled by very trained staff so that the infected, the healthcare worker will not get the infection, wearing personal protective equipment and working in suitably equipped laboratories. Procedure for safe storage and transport. We follow, 3 container packed system for samples to be strictly adhered and followed. So diagnostic test overview, I will just show you how the pattern and which test we will use. So in 5 to 21 days, that is the incubation period, there is no mean in doing any testing. And from the febrile stage, that is 1 to 4 days of the illness, you can go for tonsillar and nasopharyngeal swab, PCR, which we all know how it is being taken and how it is done. And from next day, 2 to 4 weeks, when rash comes, PCR of the tonsillar and nasopharyngeal is less significant. You can get more sample PCR from the lesions. Antigen detection can also be done during this time. And a recovery period, you will do the serum studies for antibody detection methods, although it is less, reliable. Nucleic acid detection, PCR, is the most definitive test we can identify for this. PCR is polymerase chain reaction, is the technique commonly used to confirm the monkeypox. Test conducted on the lesion material. Slightly you will cut the lesion, and using the stick of the swab you will just roll it down, and you put that in the container and cut the end tube and done this. And before that the vial should be neatly, clearly labeled, and it should be packed in with non-absorbent material. Then you will cover it with a second pack, and then you will put it in a third box, and then you will refrigerate in 4 degrees centigrade while it is transporting. This is the procedure for PCR collection from the crust. What you have to do. So detects a smallpox virus, identifies in the viral clade. Now, coming to the most important factor of this talk, I would say it is infection prevention and control. Although the COVID has given us a lot of trouble and problems, it has given us, systems and knowledge about how to do basic infection prevention and control quite outstandingly among the healthcare workers, I would say. Healthcare workers caring for the patients for handling of the specimen must be taking standard, contact, and droplet precautions. 3 things I will repeat once again. Standard precaution that you have to follow for every patient. Contact precaution, you must wear all the gown and other things just to make sure that your contact is almost nil. And droplet precaution, all the precautions you have taken during the COVID period, including the social distancing. Wash hands before and after caring the patients, touching, surrounding or handling the specimen, wear appropriate personal protective equipments including gown, gloves, mask, goggles and boots. Ensure isolation of the patient in the hospital or at home. This is very much important so that infection will not spread to other people. Ensure proper waste disposal and environmental decontamination. This is again very important. We identified all these things in the COVID time. Ensure safe and dignified burial. Ensuring that local cultural practices are respected. At the same time, the scientific things like hugging, kissing, all these things should be avoided. But with respect, with all cultural respect, all religious, all the sect, all the caste, all these should be respected, and scientifically it should be buried, the body. So that is about infection, prevention and control. And reducing the human to human transmission. Any person in contact or taking care of the person of the monkeypox should avoid the close contact. We always articulate that keep 1 meter distance every time possible. Wear gloves and other protective equipment. Always wash hands before and after caring for the sick patients. Now coming to the prevention and treatment. Case management of the monkeypox, we do not have any specific medicines targeting the monkeypox as of today, although research and clinical trials are ongoing, but still we do not have any medicines as of today. Moreover, it is less important also, we have symptom specific supportive care, and after 3 to 4 weeks it usually disappears, if not more complication has not come. First generation vaccinia vaccines used to prevent smallpox are also largely protected the vaccines from monkeypox. This will be useful for the patient's family members, especially if somebody diagnosed with this monkeypox, and if the family is not yet diagnosed. And it is very common that only 1 person or maybe 2 person is diagnosed with monkeypox and not everybody in the family. But these people need to be taken care. So it is best advisable to have this vaccinia vaccine. And in 2019, a monkeypox vaccine is already approved, although it is very less available all around the world. But hopefully the production of the vaccine will be made in tremendous amount, like what we had in Covishield, Covaxin. So that can really boost the preventive strategies against this viral infection. Further vaccinations and trials are underway. We expect to have more vaccines in the coming days. Now, coming to the elements of patient care. As we said, we do not have any specific medications attacking this virus. These are the things which we need to take care of. Fever and pain management. Pain will be very severe because of this rash. The rashes are painful. Skin, eye and mouth care. Skin care, as you know, it is very evident, but eye care is very important, because sometimes if it goes to the eye and if the proper care is not given, it can lead to the complication and the patient can lose the eyesight. Mouth care is very important, because if anybody have a sore in the mouth, nobody feel to eat or drink anything. So this is a very troublesome period for these people who get this disease, and especially when the kids goes, it really goes out of proportion. Hydration and nutritional support is another thing which we need to take care of. Mental health support, because it truly impacts the self concept of the person, self image of the person, and isolation itself. We all have, almost everybody has gone to quarantine and other part of, and we all know how stressful it is. So that mental health support is very much needed. Preventive and treatment of complication which is identified is one of the most important things which we need to do. Infection prevention and control so that it will not spread to the community, to the large number of people, which need to be taken care of. Isolation is a must for the identified case or suspected case of this disease. Now, coming to fever and pain management, external cooling is very much recommended. Remove garments, apply cool, damp clothes. Antipyretic and pain medications like paracetamol, non-steroidal, anti-inflammatory drugs, avoid these kind of drugs because NSAIDs cause severe more risk of bleeding or dehydration, and opioids when indicated. So these are the way how you can control fever and pain in these kind of patients. And coming to skin care, it is again very much important. A rash may lead to severe permanent skin damage and fluid loss. Rash and skin care, avoid touching or scratching the lesions so that it will not spread and it will not cause much more problem. Gentle washing should be done. Keep clean and dry. Protect and hydrate with moist dressing if it is more contaminated. Gentian violet or nystatin cream can be used in the severe cases. Topical or oral antibiotics as needed. Treating inguinal and genital ulcer with warm saline, sitz bath or light sofratul dressing can be done. To add on, there are many cases of genital ulcers reported in the current era, monkeypox, which is happening, which is spreading like anything in the Europe. You can see all this data from WHO, it is clearly available. Now, see how you can manage the mouth sores. That will be really painful, as I told you before. Wash mouth warm, clean salt water repeatedly, maybe 4 or 5 times a day, can really, make the patient to feel better so that, they can ingest something. For severe ulcer, consider gentian violet or antibiotics. Vitamin C and other multivitamins can contribute to the betterment of the patient. So this is how you have to take care of the mouth of this patient, and this is very vital. This should not be ignored. Now another important part, although only 20% of the people get this problem, but eye care is a very must. Eye may develop infection or ulcers, especially in African region where the undernutrition is very prevalent. Vitamin A deficiency even aggravates this problem. So vitamin A supplements can add a bit of protection. Protective eye pads, topical oral antibiotics in combination, tetracycline or trifluridine eye drops or ointment is a preferable or recommended eye care by WHO. Do not use steroid ointment or drops. This is being recommended by WHO. Now coming to respiratory care, basic infection control prevention everywhere stays. You have to ask and request and teach the patient about the respiratory etiquettes so that it will not be spread to the people around. Bronchopneumonia is a serious case which can cause death of a patient. So that need to be taken care of, and it happens in one in 10 cases. There can be tissue damage throughout the lungs and consolidation in just one area with or without bacterial infection. So if you suspect that, you may need to give antibiotics as needed. Supportive treatment, pulmonary hygiene and physiotherapy, supplementary oxygen if needed, empirical treatment with antibiotic, bronchodilator medication, and in the severe cases, there may be a need for ventilatory support also. Now, the rehydration and nutritional support. As I told you, the mouth gets lot of these rashes and anthems. So this creates a lot of problems. So the patient will not, feel like eating. So water, soups, teas, oral rehydration solution, this should be given to the patient. And the conditions which can cause, vomiting, diarrhea are very commonly seen in these patients. So that need to be identified and treated very promptly. Breastfeeding, breast milk, infant formula, according to the situation, should be given to the small babies. As of now, we do not have any, evidence stating that breast milk transfer the virus. But there is a clear evidence available that pregnant women transmit the virus to the, fetus, so, or, unborn child in a way. So this is a clear indication. And even there are reported cases of, miscarriage also because of this. So caregiver precaution should be taken, and mask and hygiene education must be done to these, patients and family. Now, coming to the, totally ignored part, the mental health and the social support. Provide psychological support. Psychologists need to be available. At least over phone, or now we have more digital mode of communication. Social worker, if can help, specifically trained nurse can help. Offer non-intrusive practical help to calm the patient and family. They will be terrified by this. After seeing this problem, they will be more terrified, and keeping on waiting for 2-3 weeks and still not recovered. They add to the problem more, and keep them informed what it is and what to expect, how to take care of themselves, and how to take care of precautions, and how to prevent issues also. You can talk to them. Now, this is for physicians. We have a complete clinical care guide for all these things, how you can do, which is available in WHO website. You can take and download it. These are the common problem. I'm not going to read out everything, but all the same only. Fever, you need to do the external cooling and regular temperature. Sepsis, you have to hemodynamically stabilize, and you have to give the symptomatic management, and everything goes according to the problem. You can go out and read this from the WHO website. Now, coming to the complication of monkeypox. Monkeypox goes and affect almost every part. It can have the fever, it can go to eye, it can give mouth and throat sores, it can affect the lungs and give pneumonia, vomiting and diarrhea it can cause, lymphadenopathy it always cause, and sepsis, and that can result to death also, and skin compromise can come almost every time. Danger signs are loss of vision, delirium, respiratory distress, and inability to urinate. All this causes problems to the patient. Now, coming to the surveillance part. This is little more, public health perspective. How you should do the surveillance. Countries at the risk should include monkeypox in their integrated disease surveillance and response system. Although with God's grace, India is not yet affected, but we have to be ready with this. All the tools are available with the WHO. We can download, and if the first case is reported anywhere, everywhere, what we have to immediately follow, which we will see in the coming slides. The goal is to detect, immediately respond to any suspected case of monkeypox, develop case definition, example of a suspected case. We have to clearly define what we are looking for. An acute illness with fever greater than 38 degrees centigrade, intense headache, lymphadenopathy, back pain, myalgia, and intense fatigue, followed 1 to 3 days later by a progressive developing rash on the face and spreading of the body, palms and hands and soles of the feet. Like this, you have to define the case so that surveillance can be done with the checklist and tick mark. So safely collect patient information and lesion samples from every suspected case for laboratory testing and get it tested and confirm the case. Now, what are the steps what we are supposed to follow? This is recommended by the WHO. Any suspected case, first that must be reported to the authorities in whichever level. If you are in very primary level, you have to report to your next level, and it must be reported. That is first and prime most thing what you have to do, and then confirm the outbreak. And how you can confirm? Go for the laboratory testing and just confirm. And once it is confirmed, convene a multidisciplinary team. Here, the One Health approach is needed. What is One Health approach? This is a zoonotic disease. Zoonotic disease need 3 people. Inter-collaboration of 3 people. That is, one is healthcare professionals, one is veterinary doctors, and another one is ecological or environmentalist. So these 3 people, along with the public health team, combine to work, collaborate to work for one aim that comes here, and it is known as One Health collaboration. And that is what we need, not only in this, almost all the zoonotic disease in the community. Develop a correct and proper case definition, identify all the cases, do the contact tracing, and describe and analyze the data, conduct special studies in your community or in our community, in whichever community we belongs to, and communicate the results for the better understanding of this disease. So this is the thing what we need to follow, and this you have to remember this because if it is reported in your area, like first COVID case was reported in India, in my district, in a place from a student who came from China, and she was in the initial time she was not ready to go to healthcare facility, and she was praying and staying in her home, and our health minister by then took a very strong decision to arrest them, and she moved ahead. So these kind of practical problems you also will be facing. So you have to make a clear plan where you have to look for. It is available in the WHO website. So you have to download all the forms and get the fact properly filled and follow the hierarchical system, so that it makes really sense for everyone. Now, outbreak response. Each suspected or confirmed case of monkeypox requires immediate response. You do not have time to think and study and lose. That's what we are doing now. When we do not have any cases here, we are preparing now, and we must act very quickly, very immediately, so that it should not spread in community, and we don't want another pan-Indian lockdown, which make poor people to walk from kilometers and kilometers and die on the road. We don't want that. Report all cases information to health authorities, initiate outbreak coordination, put in place laboratory confirmation, contact tracing, active search, rumor tracking. This is another important thing. So many rumors will come. You have to understand and you have to break it. You have to educate the community through one or other ways, like what we did in COVID, to give the factual right information so that myths will be busted when and where it is born. And enhance surveillance, initiate community education and risk communication, institute infection prevention and control measures in all the situation possible. Now coming to prevention, focus on health education and measures to reduce exposure. understand the risk of handling or consuming wild animals, and avoid contact. This you need to promulgate in the community to reduce that. Wear gloves and other protective clothing to handle or slaughter animals. Avoid close contact with the patients during human monkeypox outbreaks. So we are nearing to the last sessions. Monkeypox implication for global preparedness and disease control. WHO are really working hard to control, but still these zoonotic diseases always goes out of control, like what we are seeing now in the Europe. Even if you have high class all the infrastructure and all the processes to do the better, but still it goes out of the way. Still you have to get yourself prepared to tackle all these challenges, to address these upcoming problems, and save millions of lives in the community. Better capacity of disease control, coordinating with the global expertise, vaccines and treatments. These all are going on right now, including even today. So the key messages is it is an emerging disease. I will say it is not an emerging disease. It's an emerged disease now. It is fast spreading. Just let's wait when it will come to India. That's all. Monkeypox can be seen in endemic countries or anywhere in the world. Now more than 54. When this slide was prepared, now then it was nearly 4, 5, 6 countries, maybe less than 10. Now it is 54, which is really fast spreading. Report any suspected case. Take all precautions to prevent the spread of the monkeypox. So I think with this we come to a conclusion of the monkeypox. So it is very difficult to incorporate everything about the monkeypox in such a short 1 hour duration, but CDC and WHO has done tremendous amount of work in this regard. You can find all the information in WHO website. Additionally, WHO has also added 2 courses to their curriculum. I mean, in the online courses are available. One is on an introduction part, and another one is little intermediate course, which goes little deep into various spectrum of various dimensions of the disease. So you all can go out there today and read about it. Try to complete that course and post it on LinkedIn or on Facebook, wherever you like to. And hopefully this will really add value to your life, and this will prepare ourselves better to treat this monkeypox if it attacks India. So, thank you for listening patiently to me. I'm lucky to have this opportunity to speak in front of you all, and I'm really thankful to SGPGI Department of Telemedicine for giving me this wonderful opportunity to speak on this topic, and all the individuals, all the technicians. I'm really grateful to you all, Charlie, everybody who has associated with me in many times, even for the SARC, this one also. I'm really thankful to all of you and all the faculty members also, and SCPG administration also. I'm really grateful, and thank you.